Welcome everyone and thank you for being there. Today we'll explore the science and practical application of cold thermogenesis or cold exposure and how it can meaningfully impact metabolic health, inflammation, recovery, and longevity. Cold exposure has been practiced for centuries, but only recently have we begun to understand the mechanism behind its benefits. We'll break down how it works, what the data shows, who may benefit the most, how to get started, and when caution is needed. My goal is to provide a balanced, evidence based framework that clinicians, wellness focused individuals, and high performers can use to apply cold therapy safely and effectively. What is cold thermogenesis? Cold thermogenesis refers to the body's ability to generate heat when exposed to cold. The process requires energy, which means it increases caloric expenditure. A key component is brown adipose tissue or BAT. Unlike regular fat, which stores energy, BAT burns energy to create heat. BAT is metabolically active and closely tied to improved metabolic health and insulin sensitivity. As cold receptors on the skin detect temperature drops, the sympathetic nervous system responds. Heart rate raises slightly, blood vessels constrict, and norepinephrine is released. This cascade stimulates BAT and helps increase core body temperature. This is natural survival response, and when applied intentionally, it can produce predictable health benefits. Key mechanisms. Let's look at how cold exposure works at cellular and hormonal level. BAT activation. BAT burns fatty acid to generate heat. This increases caloric expenditure and improves metabolic health. Number 2, mitochondrial upregulation. Cold exposure stimulates mitochondrial biogenesis, increases energy capacity and resilience. Number 3, norepinephrine release. Cold stimulates the sympathetic nervous system. Norepinephrine boosts alertness, fat mobilization, and mood. Number 4, cold shock proteins. This helps cells cope with stress and improve protein integrity. Number 5, autonomic benefits. Regular exposure improves the body's ability to shift between sympathetic and parasympathetic states, enhancing stress recovery. Collectively, these mechanisms make cold exposure a powerful hormetic stressor, meaning it challenges the body just enough to stimulate adaptation. Historical and modern application. Cold exposure is not a new concept. Ancient Greek and Roman societies used cold baths for endurance and healing. Finland and Scandinavia have used sauna cold cycles for centuries. Today, the practice continues, from athletic training rooms to wellness centers. Much of the modern revival is influenced by Wim Hof and other cold training advocates, which has sparked scientific study. The take-home message: while the cultural lens has changed, the basic concept remains: temporary discomfort, lasting physiological benefits. Methods of cold exposure. There are several ways to implement cold therapy, each with its own benefit. Cold showers, the most accessible entry point. Even 30 to 60 seconds at the end of a warm shower begins the adaptation process. Cold plunge versus ice bath. More intense and reliable temperature control. Generally produces stronger physiological responses. Number 3, natural water immersion. Lakes, ocean, rivers with variable temperatures offers mental plus emotional benefits as well. Number 4, cryotherapy. Uses very cold air for short bursts. It can be beneficial, but because air conducts heat poorly compared to water, it may not activate BAT as effectively. In general, water exposure is more potent than air. Metabolic benefits. One of the biggest benefits of cold exposure is its effect on metabolic health. BAT activation increases caloric burning. Even modest activation can contribute to body composition improvements over time. Cold exposure also improves insulin sensitivity, helping cells respond better to glucose. This can be particularly useful for those with prediabetes, insulin resistance, or metabolic syndrome. Adiponectin, a hormone linked to metabolic health and fat burning, increases with cold exposure. Cold exposure also decreases systemic inflammation, one of the major drivers of cardiometabolic disease. These benefits occur without major dietary or exercise changes, but cold therapy is best used as an adjunct, not a replacement. Cardiovascular benefits. When exposed to cold, blood vessels constrict to preserve heat. This causes an acute increase in vascular tone. After exiting the cold, vessels dilate, increasing circulation. Over time, this vascular training can improve endothelial function, helping vessels respond more dynamically to stress. Cold exposure also improves HRV, which is called heart rate variability, a measure of autonomic flexibility and a strong predictor of cardiovascular health and longevity. Regular cold therapy often lowers resting heart rate and enhances parasympathetic tone, associated with better recovery and emotional regulation. For many, these benefits complement exercise and nutrition interventions. Immune, mental health, and longevity benefits. Bear with me on this. This is a very busy slide. Cold exposure triggers acute immune activation. Norepinephrine release stimulates increased white blood cell count, enhancing immune surveillance. Studies suggest fewer viral infections and reduced sickness frequency among regular cold exposure users, though this data is mostly observational. Cold also promotes a shift towards anti-inflammatory cytokines, reducing chronic systemic inflammation. This modulation supports both immune function and recovery. It's not a magic shield, but cold exposure can strengthen immune responsiveness and resilience. Mental health and recovery. Cold exposure triggers large increase in norepinephrine, as much as 200 to 300%, leading to improved concentration, focus, and alertness. Endorphins increase, creating a natural mood elevation. Many people report reduced anxiety and improved mental clarity. On the recovery side, cold decreases inflammatory signaling, which is why athletes use it following intense training. There is growing research suggesting cold exposure may produce antidepressant-like effects in certain individuals, especially when paired with breathwork and mindfulness. Longevity effects. Cold exposure acts as a hormetic stressor, a small dose of stress that triggers a beneficial cellular response. It increases mitochondrial resilience, reduces inflammatory aging pathways, and enhances DNA repair, and promotes cellular maintenance mechanisms like autophagy. Over time, this improves physiologic reserve, the body's ability to handle stress. So, similar to exercise, cold exposure doesn't just make you feel better today, it trains your biology to age more gracefully. Safety guidelines and practical implementation. Cold exposure is generally safe, but it needs to be approached with respect. Start gradually. Cold showers are ideal for beginners. Even 15 to 30 seconds is enough. Avoid cold exposure if you have uncontrolled cardiovascular disease, significant hypertension, or Raynaud's phenomena. Anyone with neuropathy or loss of sensation should be cautious. Avoid breath holds during full immersion. Hypoxia and cold can be dangerous. Always listen to your body. Cold exposure should feel uncomfortable, not painful or disorienting. Implementation. The key to effective cold therapy is consistency. Begin with short cold shower finishes, 30 to 60 seconds, 3 to 4 days per week. Progress to 2 to 3 minutes as comfortable. For plunges, aim for water temperature of 50 to 59 degrees Fahrenheit or 10 to 15 degrees Celsius for 2 to 6 minutes. Evidence suggests most benefits come from 11 to 14 total minutes per week, divided however you like. Pair with controlled breathing to maintain calm under stress. This trains both physiology and psychology. Contraindications. Cold therapy isn't appropriate for everyone. Patients with Raynaud's, uncontrolled hypertension, severe cardiac disease, cold urticaria, or neuropathy should avoid or receive medical clearances. Pregnant individuals should consult a clinician. If dizziness, confusion, or numbness occurs, stop immediately. To summarize, cold exposure is a powerful, low-cost tool to improve metabolic health, mental well-being, immune function, cardiovascular resilience, and longevity biology. It works through activation of BAT, mitochondrial strengthening, sympathetic stimulation, and anti-inflammatory signaling. It can be used by athletes, executives, and everyday individuals. And when done consistently, benefits are measurable within weeks. So where to begin? Start with small steps. Finish your showers cold for 30 to 60 seconds. Track how you feel. Energy, HRV, mood, recovery. If tolerated, progress gradually to longer exposures or cold plunges. Cold therapy is most powerful when combined with exercise, sleep optimization, strength training, and nutrition. All part of the pulseperfect approach. Thank you. Happy to take any questions.